Well, welcome back to Real Health. South Africa has the highest rate of elective cesarean sections in the world because a lot of moms are disempowered about their birthing rights and they allow these very important decisions to be made for them. To shed some light on this topic is cranial sacral therapist Justine Hunt and midwife Rueda Mula. Ladies, thank you so much for joining us. I'm so glad we're empowering moms in the spirit of women empowering themselves. Why do we have the highest rates of elective cesareans, Rueda?
I think a lot of women don't know that they have the ability to choose. A lot of the cesarean sections are done based on time of planning, gynae's planning, patients planning, the world we're living in. They're forgetting that they have the ability and they're made to do this and they are made to give birth normally and have these natural births.
And if you think about how we live, we're rushing from one place to the next. We have to be there at a certain time. That's not a way that you want to bring a child into the world, right? By saying on this date, this is when you're going to give birth.
Absolutely. And with the life that many are moving into, everyone wants things scheduled and planned. And with childbirth, it can happen at any given time, day or night. And once we accept that, I think that we'll have more natural births.
Yeah. Justine, your experience, give it to us quickly.
Yeah, I had an experience where at 34 weeks my gynae said to me I wasn't going to be able to birth naturally, which was my dream, because the cord was wrapped around my son's neck, one direction under the armpit and in the opposite direction again. And he was ready. As I walked out the appointment, he said, schedule your book now in the book for your cesarean section. And I phoned my midwife immediately once, obviously I didn't book anything. I phoned my midwife and she said, let's get a second opinion, let's see what's happening. Went for the second opinion, an amazing, completely different experience. He said, yes, right now it does look like this is going to be very challenging, but it's only 34 weeks. You've still got plenty of time. And he said, he knew the work that I did and he said, let's create a miracle. So I went, and I had body talk, I had craniosacral therapy myself, I did meditations every day, I visualized, I did hypnobirthing, and I really spoke to my son, because my process was that I was born with the cord around my neck.
Oh, wow.
And I said, please release this. You don't need to carry on my pattern. You don't need to carry my pattern through. You can choose something completely new. You can choose something completely different. Look at this beautiful birth vision I visualized for us.
Yeah.
And I went back 2 weeks later and he had completely unraveled himself from the cord.
Oh my gosh. So it's so amazing to have that experience sort of brought into fruition, and look at the change. Should women be asking their gynae certain questions to make sure that they feel safe? Because, at the end of the day, the gynae is the expert. They put their hopes, their dreams, their baby in his hands.
Absolutely. I like what Justine said about the cord. Last night I had a birth with a cord around the neck. 70% of babies are born with cord around the neck. It's just we need to assess how tight it is, how many times it is, and that's one of the things that they should be asking the gynae when they are given the options. So I think the first thing is that as a mom-to-be, chat with your care provider on your type of birth and your preferences. See if they are comfortable with natural and normal birth. The gynaes are very, very honest, I must say. Many of them will tell you that they don't do it. And then you have a backup option. Like, have a midwife and a gynae. When things are discussed with you to have a cesarean section, find out the reason. Never ever be afraid of asking for a second opinion and getting that second opinion. So when you see your gynae, find out from them how comfortable they are doing normal birth. Chat to them about the cesarean section and natural birth. Don't let them dismiss the way you feel. Be open and honest, and from that you get a feel from whether your gynae is telling you to have a cesarean section when you're 7 weeks pregnant already, or just towards the end for a proper medical reason. When gynaes looked at me the first time, they thought I was going to have a cesarean section too, because they'd ask what size shoe I wear, and I said size 3. And that is definitely not one of the reasons for cesarean section. I've had 2 normal births. I've birthed patients that are much shorter than me who's had a 4.6 kilogram baby.
Wow. Yeah.
So it's possible.
Okay. I mean, Justine, from your background as a physiotherapist as well, just your medical background, and Rueda, if you want to add, when is a cesarean section needed?
Look, there's specific conditions that Rueda can also explore, that we can both talk about, that are at risk to the mother and or to the baby, or both.
Yeah.
Like certain conditions we were talking about earlier, but then there's also no cut line, like placenta previa. If the placenta is right at the entrance where the baby would be passing out of the birth canal, there's major risk that placenta will be disrupted, and the blood supply or the oxygen supply to the child during the birth might be disrupted, and that is a risk. But you were mentioning earlier as well that there are certain people that are willing, or midwives that are willing to take that risk, So I think the most important thing is that you are empowered in the knowledge of knowing how experienced your provider is in birthing that condition, and whether you feel comfortable taking that risk or not. But the one thing for me that I really would stress is that often cesarean sections are then the planned cesarean section, whereas now we're doing what we call a guided facilitated birth, where you actually still allow the baby or the mother, to go into labor, or the baby to initiate the labor, and then you do a cesarean section. So it's not as stressful to the child, and you also know that the fetus is ready, their lungs have developed properly, and they're actually ready to be birthed.
Yeah, because let's talk about some of the risk factors and challenges to a cesarean section when the baby is not ready to come.
Yep, and that's one of the things, when we work out a due date, we must always remember it's an expected due date. Generally, the body goes into labor when the baby is ready, when it is ready to be born. At that point in time, when there's contractions, there's oxytocin release. So the body releases the love hormone, which is the most wonderful hormone.
Bonding hormone,
exactly,
yes.
Which is taken away when you have a cesarean section. So when a mom has a cesarean section, they don't have that increase in oxytocin, and they don't have that increase in prolactin, and those are the two hormones that help with breastfeeding and that helps with bonding. So one of the major benefit is passing through the canal. When that happens with a natural birth, a lot of the fluid is released. There's also a beautiful talk I went on, which is the microbiome. So the baby needs to be covered in that in order to protect it against diseases and
that's
asthma.
That's the first immune system that is imprinted on that baby and inoculated. Yeah,
exactly.
And that imprintation is as unique as a fingerprint. So if they don't bypass that, they're missing out on that microbiome structure. And that's why we try and do the gentle cesarean section, like you were saying, where you allow the mom to go into labor and then do a cesarean. The baby being inside needs to be exerted to positive stresses. We all need positive stresses. Those contractions help the baby to trigger on that positive stresses.
Wow. So get them ready for life, basically.
So what we find cranially is that as the baby is moved through the birth canal, it actually activates all of your sympathetic ganglia, which activates initiation of the first breath, the lowering of the diaphragm, and the lung expansion of the first breath. It activates the digestion, it activates that the colon starts activating and everything starts moving. So that's actually extremely important for the baby to have that pressure on their, down their spine during the natural birth, which they don't have from a cesarean section. So we find with a cesarean section, when I'm treating the baby afterwards, their whole nervous system, from the change in the amniotic fluid pressure to the air pressure, has actually sucked in. The whole membrane system's kind of like this, and we have to stretch it all out, whereas natural birth does have its own stresses on the baby, or maybe if there was a forceps delivery or compression pattern of the cranium, but the vitality within the system from having been sort of activated during the birth is much stronger.
Amazing.
We find in a natural birth, and the releases of the cranial, whether there has been cranial compressions, are a lot faster to release than this entire compression system that we find after a cesarean section.
And also, like you mentioned, sort of getting this baby ready for the fact that there will be pressure in life, but it's okay. You're going to be able to deal with it. Is there a way that if a mom is watching and she unfortunately had to go through a cesarean section for whatever reason, and she wants to now stimulate a baby and sort of, you know, take back what her baby missed out on should she have had a natural birth? What can she do?
We actually do rebirthing in cranial work. The body will invite it. It depends how many sessions are required, but often the body invites almost a birth release rebirthing experience during the cranial work.
Wow.
I experienced it myself only at the age of 25.
Wow.
Through when I was studying my cranial work, and I felt the pressure of the cord around my neck. My collarbone had broken on the way out, and I felt a searing pain through the collarbone.
Incredible.
My mom couldn't remember which one, and after my session I said to her it was this one.
Wow.
And it was a whole birth experience, and then it suddenly felt like I could take an enormous breath, and there was white light. It was a very empowering experience for me, because
very
it was
spiritual experience.
Very spiritual experience. So we're releasing the physical trauma that's happened within the cell tissue memory. But on another level, I could never wear scarves before that. They always irritated me.
Wow.
And after that, only about 2 years after that, in retrospect, I thought I've never had an issue wearing a scarf after that.
I should ask my mom. She hates turtlenecks. Perhaps there was something there as well.
Some there. She
exactly.
needs to see Justine.
I mean, do you do some sort of counselling and coaching for mothers that were concerned that they had a C-section?
Yes, they all need debriefing. A lot of moms come with a birth plan. I like to change it to birth preferences, because nothing is planned. You can never ever plan it. There's some need for a cesarean section. So if there's a maternal health indication, or the baby is not positioned in the right place, it's lying across. First time moms with a breech presentation, or high blood pressure or diabetes, or the baby is not growing well, or there's fetal distress, those mums would need to have a cesarean section. It's medically indicated. Unfortunately, in South Africa, Caesars are done without medical indication. And you know, when you want something so badly, and a lot of moms do want a normal birth and a natural birth so badly, that they can go into depression when they don't have that option. So they do need debriefing. They need to understand the reason that they've had a cesarean section. A lot of elective cesarean sections where it's planned according to schedule.
Yeah.
They need to also go back, understand that they do have an option for a second time around where they can try a natural birth after a cesarean section, so they don't feel robbed of that experience.
Okay. How much time do women have to actually make these decisions? Because often it's as if they, you know, under the gun, they have to make a decision and stick to their plan. How loose should it be? And should they then opt for another gynecologist or a birthing team if they feel that they're under pressure?
In my opinion, I feel that the pregnant mom has until the last.
Yeah.
So she has expected due date. They usually have an indication that they're having a cesarean section around about 37 weeks, because it would be discussed. The gynaes and the doctors would generally do elective cesareans at 38 weeks.
Okay.
So they generally have that 3 weeks to seek a second opinion, to have an ultrasound if they're unsure whatever was said to them initially, to do a comparison, to wait until they go into labor, and that's something they can ask the gynecologist and obstetrician. If they go into labor, can they have the cesarean section when the baby shows readiness? So they have until their last, provided that there's no fetal distress. So when there's something happening, please go in for an assessment, make sure that the baby's well-being is doing quite good.
Sometimes that's confusing, because I mean, we're not knocking gynecologists. There are amazing gynecologists out there, but sometimes interpretation comes into play here, where, you know, maybe a midwife or someone a little bit older and more experienced may say, look, no, I you know, this is not an indication that your baby and the fetus is in, or the baby's in fetal distress, and another person's opinion. But at that point in time, do you have the benefit and the luxury of time? So is it good to have a midwife and, you know, more than one type of person in your team?
I think it's great to have support. I know from my own personal experience that I can speak of, if I hadn't had my support from my midwife at that stage where my gynae was wanting to book, you know, she was there for me, she supported me, she encouraged me, go for a second opinion, let's keep our options open, let's keep looking at things. So I find that was great, you know, and if you've got that support, I think it's wonderful. And also just to add that when you, you know, right at the end, you know, often sort of if you're 37 or 38 weeks and you're breech, the gynaes will say, well, now we need to book, or we need to do it tomorrow, or such. But I actually have treated a client who was breech, and we did 2 sessions with her, and we also actually did cranial work with the fetus.
Yes.
And the baby turned.
Wow. Okay.
So I kind of agree with you. Until the last,
you have options.
You have
available.
options, and you try and use whatever options you have available. Whether you, like I did, you bring in a lot of resources. Whatever you can find of support.
As a physiotherapist, a woman that's had a C-section, are there exercises and rehabilitation protocol that you would particularly recommend based on what you see, a few months afterwards and even years afterwards?
Yes, I mean, especially they cut. It's major abdominal surgery.
Yes.
And they are actually cutting through all of your rectus abdomini and internal organs to access the child. So I would say you do need to follow the protocol afterwards. If you do stand up too quickly or move around too quickly, you are at risk of tearing the stitches, which then can obviously cause its own issues of deeper scar tissue, etc., in those muscles and in that area. And I definitely think women should go back to then a program of exercises where within a time period they progress those exercises, so maybe under the supervision of either a physiotherapist or Pilates classes, core stability activation, that kind of thing as well.
And women that have had C-sections, do they recover from birth a little bit slower than women that give birth naturally?
I think that they have to understand it's major abdominal surgery. So there are risks with anesthetic as well as themselves. The recovery is much, it's one of the most commonly practiced medical surgeries, but there are risks. So they need to take at least 6 weeks for full recovery, whereas with natural birth, everything happens much faster. They need to mobilize, and remember that they shouldn't be lying down. They need that circulation as well, but it does take a good 6 weeks of recovery, and they should work within that 6 weeks.
What I find is that often with the Caesar moms is that they do land up tearing their stitches, damaging something, hurting themselves, because unfortunately it's easy after other surgery to take your 6 weeks of rest and so obviously still mobilizing but within reason. Now you're trying to pick up a newborn baby in a cot, you're bending over, you're doing different positions you've done before, you're trying to breastfeed. It's quite a challenging time to still look after yourself and the baby.
Yeah, that's true. We did have concern from a mom that gave birth and via C-section, and then her baby had lung complications afterwards. What other types of complications can babies develop when they've been born via C-section, and how can they remedy that?
So one of the common one is with the microbiomes. They don't get that. So the immune system can be compromised. The other thing is with the lung. A lot of babies don't have that amniotic fluid being pushed out. And that they generally have a faster or rapid breathing, and that unfortunately the babies get taken away to neonatal ICU monitoring, which will affect breastfeeding. So the other thing is the breastfeeding issues. They have with a natural birth, you have that golden hour where you maintain skin-to-skin contact and you're able to breastfeed. With that, we have to try and emulate that and get that much faster. So if possible, skin-to-skin contact should be done almost immediately. With babies being separated, they do struggle to feed because they're taken to the ICU, they're given formula feeds, which could then increase the allergen risk even more, and they have feeding problems as well. And then I like a lot what she said about the spinal fluid along the brain and the ventricles.
Because what we find is, as I was talking about that activation process with the natural birth, the Caesareans unfortunately don't have that. So we find that inherently their diaphragm activation and the movement of the lungs is not, the expansion of the lungs is not as its full potential. Also, a lot of the time, if a Caesarean section is happening before 37 weeks, when the surfactant of the lungs has not been released, which is a hormone that allows for full development of the lungs, if that hasn't been released yet and the Caesarean section is happening before that time, you will often find that child is then has a lot more susceptibility to lung problems, like later on asthma, exercise-induced asthma, etc.
So there's a lot of work to be done to ensure that you can prevent some of those conditions developing later in life. You touched on hypnobirthing earlier on.
Yes.
Tell us what it is.
So hypnobirthing is basically the instructor teaches you tools and techniques to almost hypnotize yourself during your own birth. And it's accompanied, there's sessions that we do. We work with really a lot of fear release work, and it's a very conscious process.
Okay.
But she teaches you the breath techniques and positioning techniques that you can take on during your labor to facilitate the most relaxation possible. And there's also affirmations and a CD of affirmations that you get that you can use, do a relaxation every afternoon, and even one that you can have in your car. And I found that was also very, very functional and amazing, because it takes away those fears. Hollywood dramatizes birth, unfortunately.
Yeah.
It makes it this whole thing of this woman screaming her head off kind of a vibe. And it doesn't have to be that way.
Yeah.
Never mind that will actually traumatize your child.
baby. Yeah.
The louder you're screaming, they can hear that within within your body. But to be aware of your breath, to be in control of your breath, you're also maximizing your oxygen intake, which is keeping that fetus relaxed and calm. So the calmer you are during your labor, even during your entire pregnancy, the calmer that the baby will be.
Just you want to add to that?
Yes,
Yeah.
on hypnobirthing, I think one of the common reasons for Caesar as well is fear of pain.
Yes.
You feel that you're going to have less pain, you're not going to have the hours of labor. And with hypnobirthing, it's a pain management. So it helps to control and minimize the pain. So it's a beautiful technique for management of pain.
Just to close, I've heard some moms say, we live in the 21st century, we don't need pain and we don't need all of these things, and we can schedule things. What type of advice would you give to change that mom's mindset and refocus on why she's choosing to have a child and why her body was created the way it was at the end of the day?
I believe that we are, through birthing naturally, we're actually empowering ourselves to be responsible for that child. Because to me, if you can't handle a little bit of pain, being a mom is hard work. Emotionally, mentally, physically, it is hard work at different times. And I feel like the natural birth is almost a rite of passage. Because if you negate that and you choose an elective cesarean, you are then also creating opportunities where your child will have maybe possibly more issues, which might then reflect that makes your life a little bit more challenging later on. But also, I would rather choose an intense period of some pain during a natural birth than 6 weeks of pain post-operative. That was, in my mind. But there's also an amazing experience when I reached to 9 centimeters dilation. That endorphin release was so powerful that the walls actually went like this. And my midwife looked at me and said, because I was sitting on the toilet having a wee at the time, and she said, "Get off the toilet because you're going to birth soon." She could see it in my eyes. Wow. And I felt drugged. And after that, I didn't feel pain. I felt pressure, but I didn't feel pain. And I have to say that I feel that mainly some women are also, during the birthing experience, even if they're doing a natural birth, they are choosing for drugs before that, and it only happens at 8 or 9 centimeters dilation. Okay. So you have to allow your body to get to that point. If you start having drugs at 3 centimeters, your body doesn't understand what's going on.
Okay.
I want to say that we are in the 21st century.
Yeah.
Don't forget what your body is meant to do.
Yeah.
And in the 21st century, we're all scared of fear of missing out. So with that, when it comes to mind, don't miss out on the beautiful hormones that you're going to experience when you're in labor and when you're about to give birth. Don't miss out on the amazing golden hour that you're going to experience when you're holding your baby in your arms. That's going to not only influence you for the birth, but for the rest of your life for both you and baby.
Amazing. Thank you, ladies. A great, insightful discussion, of course, always coming from the two of you.